Does having a break from stimulants help avoid tolerance? So here's one way of thinking about it. Clinically, we all see a degree of tachyphylaxis, the pharmacological term. So for example, in a child or an adult where either the parent or the adult says it doesn't work like it used to. So when we think about the evidence base on formal drug holidays, it's actually quite limited. So guidelines generally allow breaks for very specific reasons. For example, to reassess the need, to manage side effects such as appetite or growth retardation in children, or to give the family a sense of what life is like off medication. But they don't necessarily state that holidays are required to prevent tolerance. Tolerance is more about downstream receptor and network adaptation. So what I mean by that is that if we're activating a receptor, the normal process is that there is a process of downregulation. So we know that that network and receptor adaptation will happen, but it's more than just about the absolute dose. So the key here to remember is that overcoming that is not always about dose escalations, because if we fall into that trap only or use dose escalations as the only strategy, what's essentially happening is that the brain is adapting to a new baseline, which is dependent on high stimulation. So in other words, the brain connects high stimulation and raises its baseline. Now, a brief planned break might at times reset expectations and allow us to reevaluate the risk-benefit. But it doesn't wash out tolerance in a simple, linear way. So when I talk to patients, I frame it like this. We don't have strong evidence that you must take breaks to keep the medication working. On the other hand, we're not looking to use the medication simply to provide boosts. So in other words, I'll stop medication for a few days because when I take it after a break, it gives me the boost to keep going. We rather aren't depending on bursts of energy to get things done, but rather keep a more sustained activity-cognition dimension, because that's essentially how the brain functions best. We do have evidence that long-term treatment improves outcomes, particularly when it's genuinely needed. So breaks can be used as a tool, reassess diagnosis, functioning, side effects. But if the main concern is loss of effect, it's important that we start looking at other factors, comorbidities that we've touched on. And here the diagnostic hierarchy can help. So important to check sleep, substance use, comorbid mood, anxiety, underlying trauma-related aspects, personality dysfunction, etc. And the environmental demands, task structure. Not just simply narrow our lens down to reflexively increasing the dose or going down the path of holiday.